and more convenient for more people. Alistair Leithhead, BBC News, US-based Lewis McCord, Washington State.
Well, let's look more closely at how such experimental technology might work for veterans. With me in the studio is Dr. Jennifer Wild, who's a consultant clinical psychologist at both Oxford University and King's College. And first, Jennifer, your reaction to what we've just seen, these experimental techniques.
I think they're really exciting. They're going to be effective. They're based on sound research, and it's quite clear how they would work. It's so important in working with people who are suffering from post-traumatic stress disorder to have them relive the traumatic memory. And if they are in treatment, often it's important to go back to the site of the trauma, which we can't do with military veterans. So immersing them in a virtual reality environment so that they can go through the trauma memory over and over again and be exposed to triggers to help their anxiety to reduce is an absolutely excellent idea.
If you could work with this technology, if you could have this delivered to your labs, would you?
I would, absolutely. I think it's excellent. It's going to be really, really helpful for the military veterans. It's different for civilian trauma, but for military veterans who are suffering from post-traumatic stress, it is so important that we can recreate some of that trauma, and we can't do it without going back to the site. So having this opportunity to do it through virtual reality is very helpful.
I was also thinking, looking at Alistair's piece there, that if you're 20-something, you've probably grown up with PlayStations and Wii machines, and you're used to that kind of virtual reality. It's maybe easy as a therapist, a psychologist, to engage.
It's going to be easier for the veterans to engage. It's going to be a more fun therapy than sitting in a room talking about it with their eyes closed, reliving the trauma. So in that sense, it's a more fun type of therapy, and we know it's effective.
Is there a danger, Dr. Wild, though, of seeing it as a panacea, and therefore you have these programs up and running, and it replaces human contact and possibly expensive therapy?
I don't think it will ever replace human contact for post-traumatic stress disorder because of the range of emotions that are experienced. So this type of equipment will help the fear reaction, but in terms of feeling guilty or feeling ashamed about actions or behaviors that were engaged in during military trauma, then it's not going to potentially touch on those. They will need a human contact with a therapist.
And just remind us, you've worked for, what, about 15 years with veterans in Iraq, from Iraq, Afghanistan. You were telling me earlier, they often say, I wish I could go back because I need to deal with it.
They wish their therapists could go and to actually see firsthand what they've been through, and that's obviously not possible, and also it would be potentially traumatizing for the therapist. So this is a very novel and a very helpful intervention to help immerse them in a traumatic-like situation that they can then talk about and be exposed to, and their anxiety will come down.
And there needs to be progress here, doesn't there? Because as we were saying, the numbers who are coming back, and now from Afghanistan, suffering from this kind of trauma, are just growing.
They're growing, and it's estimated in the US that there are 300,000 veterans suffering from post-traumatic stress.
Is it the US where the key research tends to be done? They tend to have more money to put into research from Pentagon budgets, the Department of Veterans Affairs, but are there other interesting fields of research that you'd point to?
There is a lot of research being done in the UK. There is a military trauma centre at King's College London. They're doing a lot of research on treatments for post-traumatic stress in the military. So it is not just happening in the US, although the US are using more advanced technology at this point with their veterans.
Dr. Jennifer Wild, we appreciate your expertise. Thank you very much for coming in. And we're just going to remind you as we leave with our